Mr. Green.
Thank you, Mr. Chairman, and thank you for holding this hearing. Today we begin work on a historic piece of legislation that will build on our current employer-based health insurance system to provide quality and affordable health care to all Americans. A national health care plan has been proposed since the early last century by President Theodore Roosevelt and proposed in the 1940s by President Harry Truman and the father of our chair emeritus, John Dingell. The time has come for the wealthiest nation in the world to provide access to health care for all its people. It creates a unique American system that's not a government-run single-payer system. It builds on our employer-based free enterprise system to provide health care where the private sector cannot. H.R. 3200, America's Affordable Health Choices Act, creates a new health insurance exchange in which individuals can have access to affordable health insurance coverage from the public or a private plan. Low-income individuals will be eligible for subsidy to purchase health insurance through the exchange, and people who are happy with their current employer-based insurance will be able to keep their current coverage. I'm especially happy with the inclusion of the provision I've been working on for years with my fellow Texans and Florida members that will help cover uninsured children, 12 months continuous eligibility for children in states with standalone S-CHIP programs, which will also ensure states like Texas who often children are dropped off the CHIP rolls in times of hardship. These improvements to our health care system will help us address health issues for the approximately 47 million Americans who are currently uninsured. Every American should have access to an affordable health insurance plan of their choice. H.R. 3200 also makes changes in health delivery payment system. It places an emphasis on care coordination, and I'm specifically pleased with the inclusion of the community-based medical home model provision in the bill. We know there are coordinated care programs in operation in areas of our country, but we haven't captured the true cost savings measures of these programs on a nationwide level. The various medical home models in this bill will help us improve the quality of care for special needs populations, such as the elderly and those chronic conditions, and render cost savings. I'm pleased with the significant investment in primary and preventative care as well as other workforce provisions in the bill. H.R. 3200 to help address our primary care physician shortage by funding programs that allow for residency training in community settings, such as FQHC's, Federally Qualified Health Centers. I'm glad I want to thank Mr. Sarbanes for working with our office on this provision. Giving residents the opportunity to work in our communities allows them to understand that they can make a difference by serving in the primary care field, plus they can earn a living. I'm also happy we make significant investment in the field of preventative medicine. We have a shortage of public health care professionals, and these individuals serve on the front lines for pandemic flu preparedness and give the impending influenza season. We need more preventive medicine professionals in our country. I'm disappointed we were unable to eliminate the 24-month waiting period for disability for individuals under 65 because of the enormous cost. I would hope we would continue to revisit that issue, and I know there will be some help through the facility that's created program, but we still need to deal with that. Making someone make 2 years after they've received Social Security disability for health care is just not humane. However, this bill does make improvements in the investments in our health care system so we can provide affordable health care and certain coverage and service to all Americans. Thank you, Mr. Chairman, and I look forward to marking up the bill, and I yield back my time.
Thank you, Mr. Green.